Hey, good afternoon and welcome to this week's Joint Task Force meeting. I'm here on behalf of the City of Memphis, and I will be just updating some of our numbers that are going on in the community. Our vaccine numbers today, as of close of business yesterday, we've administered 879,014 doses of COVID vaccine in the Shelby County community. With that, we have about 42% of the county fully vaccinated with either the single dose fully vaccine shot or the 2 doses. That's a little over 395,000 people are fully vaccinated in our community. That is good, but we know that we can do better and we need to do better to stop this pandemic. Our door-to-door campaign is still going strong. This week, we'll be focusing on zip codes in the area of 38106, 38126, and 38118. All of those areas have a high infection rate and a low vaccination uptake. So look for our members, our task force that's out there knocking on doors. And so far this week, we've knocked on about 1,000 doors. So look for us out there on the streets. And please take heed to what the group is, the information that they're bringing you. Our phone bank, so far since June, we have called 48,500 Memphians to encourage them to get the vaccine. These calls are being handled from the University of Memphis students who are in the health sciences field, and we do believe that this is also making some progress on our vaccine numbers. Just to remind you that there are plenty of community testing sites available if you're symptomatic or feel that you may have been exposed, a high-risk exposure. We encourage everyone to get tested. That is our first line of defense to make sure that if you do have the COVID virus, that you are able to quarantine and not pass that on to your loved ones or friends or coworkers. We do have a community pod event this weekend on September 19th at La Pulga International Flea Market at 4010 Jackson Avenue. That community event will be from 12 to 4. And also encourage you, we currently still have the Pipkin site that's open daily with no appointment needed for those that are wishing to get vaccinated. If you have any questions about any of those, any of the data, locations for testing, locations for vaccine, or monoclonal locations, or even just information about COVID, I encourage you to continue to go to our website, covid19.memphistn.gov. Again, that's covid19.memphistn.gov. And as most of you know, Mayor Strickland was diagnosed with COVID a little over a week ago. I'm glad to tell you that he is doing well. He has been recovering at home. He describes his symptoms as being somewhat feeling like he had a sinus infection, but he's feeling better every day. We continue to wish him well. I would like to add that he was fully vaccinated, and he's pretty sure that being vaccinated prevented his illness from getting worse. So Mayor Strickland leading from the front, so I'd also like to encourage those of you who have not been vaccinated to get out and get vaccinated. That's our best defense against this virus. And with that, I'll turn it over to Dr. Taylor from the Shelby County Health Department.
Good afternoon, everyone. Glad to hear that Mayor Strickland is doing better and praying that the same is true for everyone in Shelby County who is suffering from COVID-19. I'm here to give the COVID-19 update for today. New cases reported today, 491. There are an identified 6,660 active cases within 14 days of the onset or their test date. It is estimated that for every identified case, there exist about 2.5 other cases that have not been identified. The effective reproduction number is now at 0.92. It was at its lowest point on June 2nd at 0.76. Now we'll run through a couple of slides. The first slide shows new COVID-19 cases by specimen collection date. We are starting to see a slight drop-off of cases. Total cases to date during the pandemic, 136,703, with 491 cases reported today. Next slide. As you can see from last week, we are now seeing a drop in active cases by age group across all age groups. Next slide. This is a new slide for everyone. When you look at this map of Shelby County, the lighter areas represent places that have less active cases of COVID-19 by zip code, and the blue circles represent the population vaccinated in those zip codes. The larger the blue circle, the more people that are vaccinated. So as you can see, in some of the areas that are the lighter salmon color, you have less active cases and more people vaccinated in those zip codes. This is a map of all of Shelby County active cases and population. On the next slide, you'll see a similar map for pediatric cases. The same is true. In the areas with the lighter purple, those are places where there are less active cases in the county, and the corresponding blue circles are places where there are more people vaccinated. The larger the circle, the more people vaccinated. Pediatric cases remain of great concern to us. There are 119 new pediatric cases reported today. 11 children aged 17 and younger are currently hospitalized with COVID-19, and 2 are on ventilators. That is a slight improvement over this time last week, when 14 children were hospitalized and 4 were ventilated. Only 26,429 Shelby County children aged 12 to 17 are fully vaccinated, representing only 35.1% of children in that age range living in Shelby County. We would like to see that percentage increased, because not only does the vaccine protect vaccinated children from serious illness, hospitalization, and death, it also serves as a layer of protection for other children, including younger classmates and siblings who are not yet eligible for vaccination. To that end, Shelby County government has developed an exciting new marketing and education campaign to reach out to families and children to let them know that they can and should be vaccinated. So with that, I would like to bring up Shelby Williams and Kaleb Sy. Shelby Williams is from Harding Academy High School. She's a junior there and part of our Shelby County Youth Council members. And Kaleb Sy is a junior at East High School, and he is also part of our COVID-19 Community Council. Thanks to both of them in advance for everything that they've done, and they're going to tell you more about this exciting new campaign.
Good afternoon. My name is Shelby Williams, and I'm an 11th grader at Harding Academy, and I'm a member of the Shelby County Youth Council representing District 6. Recently, we've seen the number of people who have contracted COVID-19 continue to rise. We want to help put a stop to that. In order to maintain my health and safety and the health and safety of my friends and family, I've taken the vaccine. I'm a student who's around other teens each day, and I come home to younger cousins who are unable to get the vaccine and other family members whom I could put in harm's way. That's why I'm here advocating for people, and especially youth, to get the vaccine and encourage others to do so as well. After researching the virus and hearing from our friends in the medical field, my family and I realized that we needed to get vaccinated. Taking the vaccine is the safest way we can protect ourselves and others around us. Thank you.
Good evening. My name is Kaleb Sy, and I'm an 11th grader at the East System Academy High School. Over the course of the summer, I had the pleasure of serving on Shelby County Mayor Lee Harris's COVID-19 Community Council. There, I worked alongside people from all walks of life to encourage people to get vaccinated. Additionally, the COVID-19 Community Council launched a 30-second teen public service announcement to encourage young people, and even the young people at heart, to get the vaccine. In the wake of the Delta variant and other variants, it is a necessity that we get the vaccine. In addition to masking and social distancing, the vaccine is the safest and most notable way to keep not only yourself safe, but others safe. There is light at the end of this tunnel. We can make it through the tunnel when not one soul dies of COVID-19 ever again. My family and I have had multiple conversations about the vaccine, and I believe getting your COVID shots starts with that conversation. The conversation about doing the American thing, the right thing, and looking at your fellow and brother. The conversation of leading by example, and most importantly, honoring the lives of millions who've died from this pandemic. In Memphis, things like barbecue, the blues, and rock and roll music can bring people together from all walks of life. And I believe that it is imperative that all walks of life take it upon themselves to get the vaccine. We are the United States of America. We are the volunteer state. Let's stand united behind the vaccine. Thank you, and have a great day.
Thanks to Shelby and Kaleb. They are excellent. I encourage everybody to go out and watch the PSA directly after this briefing. It's going to be excellent. You will really enjoy it. With that, I will take questions.
Brad Broder, Local 24.
Thanks, Dr. Taylor. Good afternoon. To follow up kind of what you were just talking about, could you explain a little more about this marketing program and your goals of how to kind of disseminate it? Will SDS be involved, the school districts? If you just provide a little more information about this and kind of what makes this different, and I have a follow-up.
Great question. I will tell you that this is something that the students have worked on not only during the summer, but also going forward. And it's just part of our larger campaign to get the word out, particularly to parents and students in this age group, to make sure that they're getting vaccinated. As far as working with other groups, I'm going to defer that question until I have more complete information for you.
Okay, thanks, Dr. Taylor. And I know you just talked about your concern about the ongoing challenges with new pediatric cases, but the hospital numbers thankfully have dropped for the second consecutive week. Do you think the trend is there that we potentially could be on the downside of the hospital peak, or do you have any kind of overall observations about where we are with hospitalizations?
Another great question. We are cautiously optimistic that we are seeing at least a plateauing of the numbers, if not a drop in the numbers. We know that hospitalizations have decreased, and we're also seeing a slight decrease across age groups, as I showed earlier, but we also know that we have a lot of work to do. So on some of those maps that I showed you today, the evidence is clear. In areas where we're having less active cases right now, we're seeing that in those populations, we are having a higher rate of vaccination. There couldn't be any more clear evidence for folks who are still on the fence that they need to get vaccinated. And it's not only, remember, those areas are showing less cases, not only among adults, but among kids. So that vaccination is protecting the youngest people in our population.
Kelly Roberts, WMC.
Good afternoon. Playing off the mentioning of about a plateau and possibly a good outlook with how numbers have looked week over week. I know that many places in the Mid-South, including Tennessee, are in a tough spot in the sense of we had the highest case number per capita earlier in the week. Is Shelby County trending a little different than the rest of the state, or are we seeing a drop in the rest of the state as we have seen here, or are we trending a little differently? And do you think that there are causes to that? For example, the mask mandate that I know only a few counties really have.
So really, right now, our county is the only county that has a mask mandate in place for indoor spaces, and we're the only county in Tennessee that has a mask requirement in our schools. As far as drops across the state, we know that Tennessee is struggling right now. We know that we are continuing to be in a tough position here in Shelby County, but we are cautiously optimistic, as I was sharing earlier, that we're at least seeing a plateau in those cases.
How much would you credit Shelby County having that mask mandate for public indoor spaces to what we're seeing right now?
Well, I will tell you, most of the public health experts that would see us talking today would know that we cannot take full credit for that. We can't give masks full credit for that, but we can give it a lot of credit. We know that masks work. We know that masks slow viral transmission, and we also know that even though we saw an increase in pediatric cases at the start of the school year because in-person learning was back, we also know that we're starting to see at least a plateau in those cases, and I would shudder to think where we would be if we had not put that mask requirement in place for schools or in indoor spaces. So we can't take all of the credit with those mask requirements, but we can say that that's definitely been a contributing factor, along with folks going out to get vaccinated. Once again, that is a sure way to start to protect yourself, your family, and the community.
Catherine Burgess, Commercial Appeal.
Hi, thank you all for taking our questions. Saturday will be 18 months since the first COVID-19 case was confirmed in Shelby County, and we've, of course, been experiencing another surge. What have we learned or not learned in the past year and a half, and where do we go from here?
Great question. So I would say that one thing everybody has learned is how important public health is. If you didn't know it before, you definitely know it now. Your public health professionals here in Shelby County and all of your elected officials and everybody here to protect the residents of Shelby County have learned some great lessons about how important it is to protect the public's health, how important it is to get messaging right, and how important, frankly, it is to continue to hammer home that message when you know that a data-driven approach is what it takes to bring those case numbers down. There are many other lessons learned that would probably take 2 or 3 more briefings to go through, but those are the main ones.
Thank you. My second question, we've talked about the current case curve and how it's trending down. So perhaps we're headed out of this surge. But my question is, if we don't get vaccination rates up, are we possibly going to get stuck in a cycle of surge after surge, even if we get out of this one?
Well, I certainly hope not. What I'm hoping is that our vaccination rates will continue to go up, but we've also discussed this in other briefings. The nature of viruses are that if you have to deal with a high viral transmission rate, or you're dealing with a low vaccination rate, and you couple the two of those, then you're always giving that virus a chance to mutate, and viruses learn how to get around the defenses that you've already put up if this transmission is not slowed. What I'm hoping is that we have more people really deciding, because either they've had a family member that's been affected by COVID-19, or they're just really starting to hear the message that the situation that we're in is not going to end until we really pull together as a community and decide that we're going to get vaccinated and decide that we're going to wear our mask as much as possible. So I'm praying that it won't be surge after surge, but I also know that we need to get more people vaccinated in Shelby County.
We'll go back to Brad Broders with Local 24.
Thanks for the opportunity again. Appreciate it. Follow-up question for Director Sweat. I know a couple weeks ago you were really concerned about the wait times for first responder calls, ambulances, etc. Is there any update on that? Have things hopefully calmed down since that last update?
Thank you, Brad. Good question. Unfortunately, our hospitals do continue to be very challenged by the number of people that are hospitalized, especially due to COVID and other reasons. But we are continuing to work with the hospitals, our EMS providers, to come up with ways to make sure that we're able to offload our patients in as fast as possible, a timely manner, so that we're able to get back in service and to respond in the community.
Are there any other questions from any members of the media? Please raise your hand. Okay, those are all of our questions today. Any closing messages?
No, I think the message continues to be the same. I just reinforce, get vaccinated, wear your mask, practice social distancing, and let's continue to look out for each other, to look out for our neighbors, and do the responsible thing for our community and protect, so that all of us can be protected and get back to somewhat of a normal lifestyle.
Thanks, everyone. Have a good weekend, and we'll see you back here next week.